Welcome to Applied Ethical Principles in the Day-to-Day Rehabilitation of Persons Who Are Deaf. Are most of you all rehabilitation counselors for the deaf? Or RCs, CRCs? Yeah, most of you are. Is that the reason that you're here? Is to get your ethics credit for your CRC? Okay, all right. I really thrive on auditory, because I can hear, or visual feedback. So when I ask kind of a general question, I need you to respond so that I'll know that we're communicating. Can we agree to that? Good. All right, all right. So first thing I would like to do is to start off with a little story. For some people, there's only one time they give any thought to ethics. When's that? When they get caught. That's the punchline. It's okay to laugh now. Okay, thanks. We'll come back to that. Now, you all have been, has everybody got their quiz in front of them? You got your quiz in front of you? Okay, take a moment to look at that quiz and see if you can do the matching. See if you can match it up. It's an old-fashioned matching quiz. But to relieve you, you can ask your neighbor and use your cell phone. Take a minute now and look over your quiz. Working hard. Oh, working hard. Wow. If you read over that, and you don't know, that's all right. I can guarantee everybody's going to get 100. I can guarantee everybody's going to get 100. I've learned teaching millennials that they really, really like tests, and they really, really hate tests. But they like tests better when they make 100 than when they don't. So some of you that aren't millennials, you're going to make 100. You're going to be fine. You're going, what is he talking about? You'll be okay. Trust me. Trust me. Still working on it. I'm going to need to call time. Imagine I'm flashing the lights. Call time. Call time. Trust me, everybody's going to make 100. You're going to get an A++ on this. As we go through the presentation, I think you'll be able to find out the answers. So you're just going to have to pay attention to the presentation to make sure you get 100 on this. But what we're going to talk about today is I'm going to go in depth into the 6 basic principles of ethics for rehabilitation counselors and look at those principles from a day-to-day perspective of what you will encounter in your office. And then talk a little bit about the ethics of the mundane, because our jobs, many aspects of them are mundane, and then spend a good bit of time talking about the risks that you may encounter as a rehabilitation counselor. If you're used to coming to ethics presentations, you're probably used to doing case studies. We're not going to have a case study today. We're going to look at a risk assessment. It's a different way of looking at ethics to make sure that you are practicing ethically. Because the one thing we all want to avoid is practicing unethically, correct? So, you want to be ethical so that you can provide services and provide the best services you can for people who have come to you for counseling and advice and guidance and those kinds of things. For those of you with rehab counselors, they've also come to you because you got money. You got resources that you have to allocate. So we'll talk about some of the risks of being unethical. And perhaps along the way, we can have some discussion about the principles and the risks that are involved. I'd like for you to take a minute, for those of you who were here for Heather's closing presentation, she talked about if you will intentionally think about what you want to learn, that you will retain more of the information. So if you'll turn over on the other side of your quiz, and if you would, write one thing. I'm not going to do the whole 3, 2, 1. Just write one thing that you would like to know at the end of today. One thing. What's one thing that you want to know about ethics in your day-to-day work?
Not to be unethical, you mean? Try not to be unethical, is that what you mean?
If that's what you want to learn, is ways to be ethical or not be unethical. I always get mixed up with those double negatives, not be unethical. It's easier for me to say be ethical. But how to have ethical practices?
Do not break ethics.
To follow the code? Follow the code? All right, let's go. I warn those of you who are, this is a risky thing to do. The last part of the session, right after lunch, we're going to get a little deep and we're going to go to Kant. And Kant says he's the first philosopher to bring autonomy to ethics, or thinking about autonomy and what you do. And he said in law, a man is guilty when he violates the rights of others. In ethics, he's guilty if he only thinks of doing so. So if you think about doing something, then you are guilty of that act. That's what Kant is saying. So if when you are working with a client and you think about something that you need not be thinking about, then Kantian ethics says that you have not been ethical in your actions. He went on to say that the moral goodness of the action is something arising from our own will. And what he's trying to say there is that actions need to be morally right based on the virtues of the person that's acting. So the way that you act, if you have a moral center or a moral compass for yourself, then you're going to be inclined to do the right thing. We can contrast that. Anybody work with people who have antisocial personality disorders? What do you notice about people with antisocial personality disorders? What's one of the characteristics of someone with an antisocial personality disorder? You want to help me out here? Pardon?
Lack of morals.
Lack of morals. So a lack of sense of right and wrong. And just a complete sense of self.
A lack of remorse?
No, a lack of remorse. That's one of the very common indicators that someone has. So a lack of remorse indicates feeling of no responsibility for the actions that the person is taking. Yes?
A lack of insight?
Yeah, into their own behaviors and what's doing. So you have to have insight. In order to make an ethical decision, you have to have insight into what the situation is and what's the best way to respond. And then if you choose the wrong thing, I'm sure we've all made poor decisions in our life. I know I have, but I feel remorse when it's happened and try to make some kind of amends based on that. So this Kant's the guy, when you think like that, he's the guy that first put that into words, and he said those kinds of things. And he talked about two kinds of will, autonomous will and heteronymous will. And autonomous will is from within. And you make a decision to do something because that's what you want to do. That's inside of you. You do something that's right. Heteronymous will is following rules of, like a code of ethics, the laws of society. We have all of those different kinds of things. So a heteronymous will is got some kind of outside force influencing actions that the person's going to do. Everybody with me? Having fun? Okay, all right, I'll keep it up. I kind of like this stuff. So let's look at a rehab counseling example. I don't discuss Robert's disability because I respect his privacy and do not want to breach confidentiality. That's coming from within the counselor, respecting the client. That's what I want to do. That's what I choose to do. Whereas a heteronymous, more heteronymously driven, is I do not discuss Robert's disability because that's a breach of the code of ethics or my policy where I work related to confidentiality. One is internal. I don't want to discuss him. I don't want to discuss his confidential information because that's not the right thing to do. Versus I'm not discussing it because the code of ethics policy tell me to do that. One is externally driven. It goes back, those of you kind of go back into internal and external locus of control. It's an external locus of control. It's telling them what to do. Can you all think of another example of that? What would be an example of an action that a counselor has to take that could be driven by what you believe or by what you're told?
As a CRP provider, VR counselors make decisions, and those come before me, and the consumer also comes to me. And I recognize that the VR counselor is just following policy, but oftentimes consumers don't understand that, and things need to be adapted or adjusted for them. So I don't know if that would be autonomous or heteronymous, which ones I do.
That falls. If the counselor is following policy, then the counselor is acting in a heteronymous way because we don't know if the counselor believes that or not. All you can see is that the policy is being followed. And let's say it has something to do with purchase of services. And then the rules and regulations of the agency are dictating to the counselor what to do. The counselor may or may not believe in that rule, but is following that rule. That's an example of heteronymous will, because external forces are telling that counselor how to act and behave. And sometimes that can cause conflict between the counselor and the client, or the counselor and a community rehabilitation program. So you've got three different actors there. And if everybody's on the same, following the same rules, it's not a problem. But if one person has rules to follow, CRP has other rules, and the client has different internal rules, then you see the potential for ethical dilemmas. That's a very good example.
Also, in VR, there's a lot of gray areas. And so, I mean, when you're talking about policy, that can be pretty clear cut. But there's a lot of examples where it's not clear cut, and that's where it gets challenging. Because then you're talking about the internal and the external.
Now, let me see if I got you right. Within vocational rehabilitation, there are some clear-cut rules to follow, and there's gray areas. Gray areas. I worked in state VR, and in the deaf community, they know which counselor is going to be more inclined to provide some services than another counselor. And they counselor shop is what they do. And so The counselor has to make those decisions, and is the decision, is this in the best interest of the client because I believe it's in the best interest, autonomous will, or is this in the best interest because that's what policy tells me, heteronomous will? You don't really know unless you ask the counselor. Are you doing this because rules say so, or are you doing this because that's what you really believe?
So which is right or wrong, right? So, or is there right or wrong?
Oh, the one thing I like about teaching ethics is there's very little black and white. It's far more than 50 shades of gray. Waiting for the laughter. 50 shades of gray. Ha ha ha. Thank you. Okay, so you've got all that gray. Some are darker gray than others. And it depends on counselor interpretation. When I was in Texas, I worked with a counselor for the deaf, and he was in El Paso. And he believed that clients, he kind of followed the Weight Watcher philosophy, that you need to contribute, and he believed that clients needed to contribute. And he would assess a client $10 or $5 or $25 to pay for part of the client's rehabilitation process. I'm sure that the people in Austin were ready to strangle him with all those, they'd pay in cash or chickens or whatever they had, and they would, but, he believed strongly in that, and he was able to use policy to match his beliefs. He also had one of the highest closure rates in Texas at that time, which I think is kind of interesting. But he would assess them. So he believed that people need to participate in the rehabilitation process and pay for that. And so he charged them, and policy permitted him to do that, but I don't think that people were real happy about that. Yes, ma'am?
I think sometimes these two different wills can really align. So if a client has a medical situation that you know about, but the counselor knows that the medical doctor isn't aware of that. There's a known, the autonomous will may want to let the doctor know that, but we don't have a release of information to share it. So with the heteronomous doesn't really align with that, but so I think you might choose not to tell because of policy, but you really want to tell because it's best for the consumer. So I think they kind of go hand in hand.
Excellent example of the conflict between free will and imposed will. That's a great example of that. And then you have to decide, are you going to be comfortable with that in your organization? How are you going to, you have to decide if that's something you're going to continue to do. Most folks come to some kind of compromise with those potential ethical dilemmas. But that's autonomous and heteronomous will. Let's look at morals and ethics. We all have our individual morals that we use to make decisions about what we're going to do. Right? I just read 40 papers from 40 millennials about their personal code of ethics. And they talked about the values of their family, their faith, not too much about friends and social media, which I thought was interesting, but they talked about the influences that help them to learn how to make decisions about what to do. And that's your personal morals. You have those morals. And then in what we have in business ethics or professional ethics is a rational way of deciding based on different moral principles. You've got different moral principles, and you can look to ethics to make a decision about which one you're going to follow. Such as the example that the woman in the back gave about you want to share information with the doctor, but you can't do it because policy prohibits it until you get a release of information. But your code of ethics, that falls under confidentiality, and your code of ethics tells you which way you need to go. It's a compass to help you to make decisions, and you use that. So is there a difference between morals and ethics? Is there a difference? Do you think they're the same? No, different. They are different. Morals are about your personal character, and that's who you are. And that can be your religious beliefs, that can be your cultural beliefs, the different types of beliefs that you have. Ethics is applied in a social system. And in your ethical code, hopefully, parallels or coincides with your personal morals. Doesn't always, but you're going to have some difference there. Let me give you an example on that one. Rehab counselor who's culturally deaf prefers ASL for people who are deaf. The ethics of a rehab counselor require respect for all modes of communication. Counseling ethics must override personal morals for the greater good of persons served. Can you think of another example along these lines where related to deafness that you would have a personal value that may conflict with an ethical value? Did y'all know you were going to have to think? Thought you were going to be passive vessels today, and I was just going to walk over there, lift up the top part of your cranium, pour the ethics in, and then she signs off on 3 hours. Don't work that way. Let me help you out. Young person comes to you, you're a rehab counselor, young person says, I want a post-secondary education program. I want to go to college. Where is the best place in the United States for this culturally deaf high school senior to go to college?
Gallaudet.
I just heard a bunch of morals going here. Now, can you think of a culturally deaf young man who may live in Portland, Oregon, who doesn't want to go to Gallaudet? So what do? Give them choices.
Give them options.
Give them choices. Give them options. Hopefully they can make an informed decision. And you can go with the pros and the cons and all that kind of stuff. But just to go, you, young man, young woman, deaf, sign, beautiful, Gallaudet. No. I've seen people go up there. Let me just rephrase it. If you haven't been to Gallaudet, it's a little bit of a culture shock. It's this beautiful campus in the middle of a area that some people find not comfortable to be in. All right, let's look at the 6 ethical principles, and we're going to go deep into those today. Beneficence, autonomy, non-maleficence, fidelity, justice, and veracity. And you've got those ethical principles of counseling, and you've got a dilemma, and you're kind of like this person in the picture. You're trying to figure out, which way am I going to go? Which one of these apply? Now, I can present them from an academic standpoint and go, sure, this is going to be beneficence. That's clearly what it is. Real life doesn't work that way. It doesn't work that way. I'm going to try to present them nice and clean academically, because once you understand them clean and academically, then you can start going into the real life turbulence that you practice every day as a counselor. But you have to go through this process. So the first one is of the moral principles that we've got is autonomy. And that's all about self-determination and the right to make choices. And what you want to do is to decrease the client's dependence on you, correct? The best closure is somebody that you never see again. They may pop in. The best closure is somebody who pops in 10 years later and says, you remember me? You helped me to blah, 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 blah. And you go, sure, yeah. And then they tell you all their success and stuff like that. That's what you want. You don't want them to be there. And you want to increase their empowerment. I thought it was real interesting the other day. I've seen 2 signs for empowerment. One sign for empowerment is taking the power from the arm and giving it to the person. And I've seen that one a lot. I've also seen another sign for empowerment, which I kind of like better, which is taking the power and giving it to the person. Power to the person. But what you're trying to do is to increase that empowerment. How do you increase empowerment? Lady over here was you were right on the money. You provide information so the person can make an informed choice, because an empowerment is about information. If a person has information, then that person can make a choice or a decision. And that's what you want to do. So let's look at an autonomy example. We've got the consumer, client, customer. I travel all over, and I never patient, student. There's all different labels that we have. I prefer people, but it makes it a little easier to talk about here. Consumer Tamika is considering a cochlear implant. There's a conflict between the client, between the CI that facilitates communication, right? The CI facilitates communication, but may have risk associated with surgery. Y'all probably already know this, such as injury to the facial nerve or tinnitus, those kinds of things, and complete loss of residual hearing. Depends on batteries for the rest of their life, and there's other complications. And y'all probably all familiar with that. But she's considering one, and you are the counselor, and you're trying to consider with her. You can do nothing and encourage her to do nothing, and you avoid all those risks, and she'll continue at her current level of functioning. But the actual solution is to apply autonomy to decide. So how do you apply autonomy to decide if this young woman, Tamika, is considering a cochlear implant? Russ.
Make sure she has all the information she needs so she can make an informed choice.
What kind of information?
Financial information, and factual information about each choice. And then discuss anything she needs to discuss with you.
Okay. Anything else?
Talk to someone who's had that implant.
Okay. Maybe talk to somebody who's had the implant and talk about their experiences and what they're doing. Okay. So factual information. It's interesting. We got the quantitative guy here, and we got the qualitative person in the back. Talk to people about it, get the facts. You need both of those and provide that information, and then that will help Tamika make a decision. Is this the right thing for me? Yes?
Now, the problem with talking with just one person or even just two people is that you can get a really slanted view of it, because those two people may not be representative. So yeah, that's the problem with that.
Yeah, let me see if I heard you right. The problem could be it's how you pick your witnesses, so to speak. If you pick two people that love cochlear implants, that's going to be one scenario. Two people that have had bad experiences, that's another one. So do you want to be, at the risk of saying this, fair and balanced and have one from each? Who do you pick? That's something you want to do. Yes? Do you want to say something?
Oh, yeah, that's a challenge, I would say, variety.
Yeah. Yes.
I think also we have to be really careful, because the biases that we already have are going to impact the facts that we look for to provide, and the people that we're already connected with to refer to. And there may be these other resources and this other world that, based on kind of what we've already been hearing, we're unaware of. I think it's more than just, I know all these facts, so I'll give them to you, but making sure that we're taking the time that there's nothing we're missing.
Yeah. Well, you've got your own bias, as you point out. You've got your own. There's probably people in here, some people that are strong supporters of cochlear implants, and other people are kind of, I don't know. And then there's other people that's like, no, I don't think that's a good idea. Yes.
I think it's also really valuable to open a dialogue and question why Tamika wants a cochlear implant. What is it that is attractive or appealing? And see if maybe there are some misconceptions or if all of the information or values that Tamika personally holds would actually be resolved effectively with a company.
So we've got, give them the facts, talk to somebody else, and a great idea, talk to the client. Talk to Tamika. Why are you interested in this? I think that's absolutely great. You're going to have to do all of these things. And in order to practice autonomy with clients you serve, what did we just talk about? It's going to take a lot of time. It's going to take a lot of time. And all of you've got big caseloads and all of those kinds of things. So that's why Code of Ethics is so, it's so critical, but it's also so easy not to think about until you get caught. And it's easy, one of those things to do. Let's try another one. Do no harm. And then I think that's primum non docere. If any Latin scholars in here, feel free to correct me. And that is non-maleficence. And non-maleficence, doing no harm. That's the basis of what we do in rehabilitation. Most of your practice is not doing harm. Most people think it's in the doing good one. No, it's not. Most of your practice is in the making sure that you do no harm. Of course, we know intentional harm is, you don't do that. That's pretty obvious. But it's the unintentional, that subtle, letting your biases come through that you have to watch out for to make sure that you're not harming anyone. You know, what I say, you're consumer at risk for harm while trying to be helpful. For example, if you place somebody in a job that will exacerbate a disabling condition. When I was in San Antonio, we did some job placement, and it was in a very loud environment, and we weren't worried about hearing protectors and things like that, which wasn't too good on our part, and we placed some severely hard of hearing people in there who were later able to file a workers' comp case because their hearing deteriorated due to prolonged noise exposure. And so you need to be careful and think about things like that. We didn't. We were at fault, and we fixed that, but that's a different story. So let's look at another example. You got a consumer who's hard of hearing, functions well with his hearing aids, good with his hands, likes to make birdhouses and wooden projects, but he needs a low noise environment. There's a job at the local cabinet shop making that has power saws, forklifts, and other industrial noise. Counselor critically reviews the potential site. So if you've got somebody like that who's hard of hearing, like we had in San Antonio as well, how do you consider the job placement? Okay to do that?
Well, I think I would ask the customer if he's willing to wear protective ear cover.
You would ask the customer if he would be willing to wear protective ear covers. OSHA may cover that, depending on the shop and the decibel level and all that kind of stuff. That's a reasonable request. Anybody else think of something else they might want to do? Would you want to consider a job that potentially exacerbates the disability? Sometimes headaches.
Right, if you're a hard of hearing person, it could cause headaches.
It can also cause ringing in the ear, tinnitus.
So you have to look at that environment, and jobs aren't quite as bad to get. That's what they tell me. That word hasn't trickled into Eastern North Carolina yet. We still have high unemployment, except for the little oasis I live in right around the university. There's some building and stuff going on, but the rest of the counties and stuff, there's no jobs out there. So if you've got somebody, there's a job opening, how do you make sure that you're not going to harm that person? What tool do you have to examine jobs? Yes?
Oh, I was just thinking about the sentence, however you perform them. be interested in learning more about that. Get more information.
Okay, okay. Yeah. You would want to know what his functional hearing is and what's causing him to want to be in that environment. Could be headaches, could be tinnitus, could be he makes him anxious, whatever the issue is. But you also have job analysis tools that you can use to go into that job and make a determination of what are the essential functions of that job and how many of those essential functions need to be done, and with hearing to help make a determination if you can place somebody in that job so that you don't do any harm. So that's a tool that you've got that you can use. All right, let's go. You ready to go to another one? Yes? No? You want to stay here? Well, I guess my finger decided for me. Beneficence, that's doing good. And that's what you think you're doing. As a counselor, you're out there doing good, right? Aren't you doing good? Helping people? Actually, when what you're really trying to do is make sure you don't harm them. But beneficent is about doing good for individuals and doing good for society. Doing both of those. And it's kind of interesting that the way that you look at beneficence is a cost-benefit analysis. And those of you who are quantitative, like Russ here, he's already got dollar signs, making the Republican argument for rehabilitation, which is return on investment. But you also have other cost-benefit. What's it going to cost in the person's time? What's it going to cost in the person's need for transportation? What are those costs, and what's the benefit to the client? Single mom, great job on the other side of the town, has to take bus system. Takes her an hour and 15 minutes to get there in the morning, and the way the bus system is, it takes her 2 hours to get home. She at least lives in a town with a bus system. So is that a benefit to her to go into that kind of situation? So you're looking at those kinds of things. We see this in healthcare. If you look at healthcare, some of the more aggressive treatments can also have risks involved with them. And so you have to, which one's going to do good for the individual? Let's look at an example for this one. Consumer Yoko has a tentative job offer and needs an AT evaluation and possible upgrade of her technology. Counselor Hector contacts the AT vendor to arrange the evaluation with time to allow for purchase of a new device if needed. I just got one amen on that one, so I'm glad to see that. So why is that an example of beneficence? What makes that beneficent? All of you agree it's a good thing, right, Russ?
That's a great example of beneficence. Because the counselor is doing their active duty to do what's best for the client instead of just kind of sitting back and passively watching the process happen. Here that you see the counselor engaged and doing things for the good of the client.
Perfect, perfect. Let's go into justice. Justice is all about being fair. And the key is equitable distribution of risks and benefits. Equitable distribution of risks and benefits. Here's an example some of you may have experienced. Falls under the practice of justice. Consumer Rosette has attended 2, both of those were late, and was a no-show for 6 of 8 appointments. So she had 8 appointments. She showed up for 2 of them, late both times. She missed 6 appointments. Counselor closes the case. Why is that an example of justice? Okay, Ross.
I know, I'm just ready to jump in there all the time, huh? I think that's an example of justice because it's fair to all the clients. The same rules apply across the board. This consumer isn't making an exception for this one consumer and then making everyone else show up to all their meetings on time.
So it has to do with fairness to all clients. Is that Did you want to say something?
I would say definitely if the other people are showing up on time and this person is skipping their appointments, those other people who would show up on time may be stuck on a waiting list.
Yeah, it's not fair to them if you're not providing services to them while you're waiting on this other person. Yes.
I think it can be a little tough sometimes. Maybe it's a bit different working in the mental health settings. But one example is a client that I have who has bipolar and sometimes doesn't show up when they're manic. She really can't think straight when she's in a manic phase. And so remembering to come to an appointment is just not possible due to her mental illness. I have another client who is sometimes stable and sometimes not. And sometimes when she's stable, she just doesn't want to come to the appointment. So that's kind of a different situation. I think that there can be some flexibility. If you know the reason behind it, you can work with that rather than just closing the file right away. So I think it can depend and needs to be addressed on a case-by-case basis.
Excellent. That is excellent. All of this is contextual. All of this is contextual. So if you are working with someone and you know that backstory, like you just said, the individual who's bipolar, and you can anticipate there's probably going to be some missed appointments, then you can make allowances for that and try to be fair to the individual at the same time being fair to the other clients that you're seeing on your caseload. So that's a great example of applying the context of the situation. Remember I said there's more than 50 shades of gray? This is a great example of that. When you close the case, it's really difficult to make a hard and fast rule. Miss 6 appointments out. Go to the end of the line again. The person who misses 6 appointments may be the person who really, really needs the 7th appointment. So that's when you get into policy and guidelines and problems like that. At some point, you have to make a decision. All right, next, this is a forewarning. This is meant to be humorous. On a tombstone in England, remember, man, as you walk by, as you are now, so once was I. As I am now, you soon will be. Prepare yourself and follow me. And then somebody scribbled at the bottom of the tombstone, to follow you I'll not consent until I know which way you went. Which is my lead-in to fidelity. Fidelity. That's when you make a commitment. And when you make a commitment to a client, you follow through with that commitment. I like the sign for Fidelity Investments because they're saying, hey, give us your money. Trust us. We're going to do good for you. Hey, that sounds like counseling. Come to see me. I'm going to counsel you. I'm going to do good with you. Hopefully, the return on investment in counseling is in life improvement and life enhancement and not just in capital gains. But there are some similarities there in that you make realistic commitments and keep your promises. You want to ruin rapport with the client and make a promise you can't keep. Guaranteed. Works pretty well in life too. If you're in a relationship with someone, make them a promise and then don't keep it. Good way to have a good discussion over dinner. So you want to keep your commitments to your clients, you want to keep your commitments to your colleagues, and you want to practice fidelity. You want to show that you can keep your promise, show that you can do. So here's my example on that. Counselor Jonas renewed his CRC. How is that an example of fidelity? How is getting your CRC an example of keeping your promise? Who's paying, Russ? Go ahead.
I think that's a good example of fidelity because the counselor is committed to ongoing ongoing work and following the policy and the code of ethics under the CRC. You can see his commitment and his follow-through by renewing his license.
Right. If you have your certification, any of you LPCs or LCAS, licensed professional counselor, licensed clinical addiction specialist, certified rehabilitation counselor, I'm a certified vocational evaluator and a professional vocational evaluator. And with those credentials, what we are saying is that we're making a promise that we're going to give you the best service that we can. Yes?
It's continuing to learn and grow through the courses, the classes that we take, which is all part of the CRC.
Yes, yes. Being a part of the CRC is continuing to learn and to grow and to develop and come to an ethics workshop on a Thursday afternoon after you've been in 3 days of training. Yeah, is it Jared?
Yes, it's Jared. And not only learning through workshops, but learning from every single client. Our clients are so diverse, and so figuring out to meet each person's need individually is also a learning process.
Okay, yeah. There's so much learning. There's formal learning, informal learning, and all of those are represented by our credentials, which say to the world, we have made a commitment to be a professional, and when you come to us for service, we're going to do the best that we can. So that's fidelity. Then there is veracity, and that's the principle of telling the truth, which we all like, we all agree, and that's grounded in our respect for others. That's grounded in our respect for clients. That's grounded in our respect for them as human beings. And under veracity, what you see are two kinds of errors. One is lying, just out lying, and the other is omission. Not telling the truth, but not the whole truth. And that falls under veracity as well. When you think about your documentation that you do, then as you are documenting, are you telling the whole truth? Do you document everything you need to document? Have you ever been told, don't answer this, just think to yourself. Have you ever been told not to document something? We don't want that in there. A good example of that in North Carolina is I work with the Workers' Compensation Board, and they do not want to know if the injured worker has a history of substance use. They don't want to know it. They don't want it documented. They don't want it written down. Client was in a 28-day rehab program, which is almost non-existent anymore. Client was in a 28-day rehab program, returned to work, and relapsed and had an accident. They don't want that backstory. They just want to know what happened that day. And by omitting that information, if I do that, then I'm violating the tenet of veracity by omitting truth.
Why don't they want that information?
Why don't they want that information? Well, what do you suppose? If I know something, then what am I going to have to do? I'm going to have to spend money to deal with it. Vocational rehabilitation used to be like that. I'm not going to name the states, but there were several states that had a don't ask, don't tell policy when it came to substance abuse. And it's because if you documented the disability of spinal cord injury, deafness, blindness, whatever, and a secondary of substance abuse, then your plan had to cover both disabilities. And so by not documenting it, you only had to deal with the one disability. So, a lot of issues. See how it starts bubbling up? Yes.
That is an interesting point. I do have a staff that often wonders about what to put down because health issues are a concern for that person on my staff. If there are secondary issues like cancer or just some other kind of medical issue, they would always come up and ask about that because it's something they'd rather not have in the notes. It's not related to their work abilities.
Okay. Let's see who responds out there. I've got one response in the back.
Well, I'm a licensed clinical social worker, and I do work in mental health. And I do work in similar situations sometimes. And if they sign a release of information, you absolutely can do that. And sometimes even if they do sign a release, I won't share it. But if it's going to affect their work, they need to know. I mean, if it comes up in therapy and I know it's not going to affect their work, we don't need to talk about it. But if I feel like it might, then I can talk about that with the client and find out whether or not it's something we need to broach with their employer. If it's going to impact their work, then, I mean, you're not going to share all of that information, of course, but they might need to know if it impacts the work.
No. Okay, see, we're starting to get in the gray here. What do you do? One lens that you can apply, there's an ethical problem-solving model you can apply that looks at it from a vocational perspective. What do you need to know related to work? And that is one way of approaching what do you document and what do you not document. I think everybody's probably going to tell the truth, but how much of the truth are you going to tell? I read a 110-page vocational evaluation report that documented everything that client had done since about pre-kindergarten. About 10 pages of background information. Way too much stuff. Way too much stuff. That's an example on the far end of way too much stuff. And then I've seen other reports where the background information is 2 sentences. So those are the kind of extremes. So how much do you include in? As a CRP doing business with VR, what I would suggest you do is ask VR what they want. And then be in communication with the counselor when you find out stuff. Because one of the beauties of a CRP is that we find out stuff that a counselor with 200 clients can't find out. Because we can sit down and talk to them a little bit longer. Yes?
I wanted to add kind of what you were saying. I think it's really important that the clients are aware of what information is being given, because you do share a lot more information, potentially, with a mental health counselor than you would with a vocational counselor.
Right.
Where you're trying to impress, it's a pretty fine word. And I think it's so important that clients aren't surprised by that.
Right.
That they do have kind of some control over who's what about their clients.
Right, right. Well, people that do job placement run into that. How much do you disclose about the individual? And do you disclose? Does the individual disclose? And that all falls under this particular principle. And none of them stand alone. Do you see we're starting to get into that thing called autonomy? Where we want to support their own decisions and support their own information. And if we go out and give information about them to an employer, and it's really their choice to make, so this is not black and white, folks. It's not real clean. I just try to present them clean academically so we can discuss the thoughts behind them and practice. It's like that first picture I showed you. It's like that. All right, let's see if an example. Counselor Ned knows that when he is reviewing an informed consent, test results or other complicated matters in ASL, then he needs to take time and make sure the consumer understands. Did y'all sign the release to be videotaped? Is it making its way around? I'll call on Jared the expert. Is it coming around? The release there's a stack of them back there that you'll be signing. Take a look at that and see how long it might take you to explain all the nuances of that particular little form in American Sign Language. Say somebody who has limited communication skills. And so you all are probably used to doing this, right? Taking extra time to explain release of information, what you're having people sign. I'm going to guess, correct? I remember the days when a rehab counselor just kept a stack of plans in his office blank, said, here, sign this. We'd fill them out. Hopefully those days are gone. Did you know, we've gone over 6 principles. Did you know that there is a 7th principle? Were you aware of that? Would you like to know what it is? Self-care. Self-care. What do you do for you. I just read an article about what's his name, Tim Cook, the CEO of Apple, and some of the other CEOs in the country. They average 100-hour work weeks because they feel that we've got to have so much work to get done. Do you feel like are you at the Tim Cook level of 100-hour work weeks? Hopefully not. Hopefully you take some time. We'll just take a quick second on this one. I like to exercise for my self-care. I like to go to the gym. It's what I enjoy doing. And then I'm going to ask you, how about you? Instead of telling me, tell your neighbor. What do you do for self-care? It's interesting. It's interesting. I heard somebody over here say Netflix, and I saw somebody over there fingerspell at the same time. Netflix. I also saw exercise, dancing for a minute, and one that is kind of self-care, but in a way it cannot be self-care, and that is, I like happy hour. I get home, last hour, happy hour. Somebody else said it. Somebody else, not you. Says yeah, they're talking about me making my margaritas. I'll give you the recipe if you're interested. Anyway, that's something that you need to think about. That's the 7th principle. What do you do to prevent yourself from building up compassion fatigue or empathy fatigue? When you stop to think about what you do every day as a counselor, you talk to people at some of their lowest points in their life. When you're unemployed, that's a low point. I went to work for the Research and Training Center in Northern Illinois University. I started February 1st, 1995. September 15th, 1995, I was laid off. Funding was cut. Took me 6 months to find a job. That's the loneliest 6 months of my life. Because when you're not working, all your work buddies aren't there to play with you. And just looking for a job. Plus, I had to go to the unemployment office and stand in the line to tell them I was looking for a job, to get my check. Very humiliating experience to do that. So I learned to practice some self-care and try to do that. I hope you do too. Let me see, I've got an hour and 5 minutes up here. Is everybody okay? You need a short break? Keep going? We're okay? Yeah, okay. I'm going to change gears. Yes on the break?